Welcome back to Ageless Mind and Body, where we help you stay sharp, strong, and vibrant, no matter your age. Today we're talking about something most people overlook until it's too late. Your feet. That's right, those everyday workhorses down at the bottom of your body could be trying to send you a life-saving message. You might think kidney problems only show up in urine tests or lab reports. But in reality, your feet often reveal the earliest and most dangerous signs of kidney failure long before any blood test does. Swelling, itching, discoloration. Restless legs at night. These aren't just minor annoyances, they could be your body's quiet way of screaming for help. Over 35 million Americans have kidney disease, and most of them don't even know it. Why? Because the signs are sneaky, silent, easy to ignore. So in this video, we're breaking down 7 toxic foot symptoms you should never ignore. If you catch them early, you might avoid dialysis, prevent serious complications, and even protect your life. Stay tuned and be sure to like, subscribe, and hit that bell, because Ageless Mind and Body is your guide to living longer, healthier, and better. Starting right now. 1. Foot swelling. Swelling in the feet and ankles, also known as edema, is one of the earliest and most visible signs that something may be wrong with your kidneys. While occasional puffiness might not seem alarming, persistent or worsening swelling can be a serious red flag. Your kidneys play a vital role in filtering waste excess salt and fluid from your body. When they start to fail, this process becomes less efficient, leading to fluid buildup in the lower extremities. Gravity naturally pulls fluid downwards, which is why your feet and ankles are often the first places to show signs of retention. Many people assume that kidney issues only reveal themselves through changes in urination. But in truth, your feet can be one of the most accurate indicators of hidden kidney dysfunction. Swelling can range from mild puffiness to severe ballooning that makes it hard to fit into shoes or socks. One especially telling sign is what's called pitting edema. You can check for it by pressing your finger gently but firmly into the swollen area of your foot for a few seconds. If an indentation remains after you lift your finger, that's pitting edema, a classic marker of excess fluid retention and a potential sign of compromised kidney function. This type of swelling may be more noticeable at the end of the day, especially if you've been standing or sitting for long periods. Some people wake up with normal-looking feet in the morning, only to find them swollen again by the evening. If you notice consistent swelling, especially if it's accompanied by other symptoms like fatigue changes in urination or shortness of breath, it's time to talk to your doctor. Even if your urine output seems normal, your kidneys could still be failing quietly in the background. In fact, many patients who end up on dialysis still produce urine, but that urine isn't being properly filtered, meaning toxins and fluids are staying in the body. Don't dismiss foot swelling as just a result of a long day or uncomfortable shoes. While it could be harmless, it could also be a subtle but urgent warning from your kidneys. Early detection is crucial in managing kidney disease and potentially slowing its progression. If your feet are trying to tell you something, don't ignore them. Your kidneys and your health depend on it. 2. Numbness or tingling. Numbness or tingling in the feet, medically known as peripheral neuropathy, can be one of the earliest and most overlooked warning signs of kidney disease. While kidney problems are often associated with changes in urination or blood pressure, the impact they have on the nervous system is just as critical. Your kidneys are responsible for filtering waste toxins and excess fluids from your bloodstream. When kidney function declines, these harmful substances begin to accumulate in the body, and over time they can damage the peripheral nerves, especially those in the feet and legs, which are the farthest from the heart and most vulnerable to poor circulation and toxin overload. This nerve damage may start subtly with sensations like tingling, prickling, or a pins and needles feeling that comes and goes. Some people describe it as a crawling or buzzing sensation or a strange numbness that makes it feel like they're wearing socks even when they're barefoot. As it progresses, the symptoms can become more intense and persistent, turning into a burning or stabbing pain that interferes with daily life mobility and even sleep. Because the damage occurs gradually, many people ignore these symptoms or assume they're just part of getting older, which delays diagnosis and treatment. One of the most concerning risks of peripheral neuropathy is the loss of protective sensation. This means you might step on a sharp object, develop a blister, or sustain an injury without even realizing it. Without proper sensation, wounds can go unnoticed, become infected, and lead to serious complications like ulcers or, in severe cases, amputations. This is especially dangerous for people with diabetes who are already at higher risk for both kidney disease and neuropathy. It's also important to understand that peripheral neuropathy is not only about physical discomfort, it's a sign that your body is being overwhelmed by toxins due to declining kidney function. If you're experiencing any kind of persistent numbness, tingling, or unusual sensations in your feet, don't ignore them. Talk to your doctor and ask about getting your kidney function tested. Early detection of kidney disease can slow its progression, prevent further nerve damage, and improve your quality of life. Your feet are sending a message. Listen to them before the symptoms become irreversible. Taking action now could make all the difference for your long-term health and independence. 3. Foot pain or discomfort. Foot pain or discomfort is often brushed off as something minor, a result of standing too long, wearing uncomfortable shoes, or simply aging. But when this pain becomes persistent, unusual, or unexplained, it may actually be a warning sign of something far more serious: kidney dysfunction. One of the lesser-known roles of your kidneys is managing the balance of essential minerals like calcium and phosphorus in your body. When your kidneys begin to fail, this delicate balance is disrupted. As a result, the bones can become weak, brittle, and prone to pain, a condition known as renal osteodystrophy. This kidney-related bone disease doesn't just affect the spine or hips, it can manifest in your feet, especially since they bear the weight of your entire body every day. You might notice a deep, dull ache in the bones of your feet that doesn't go away with rest and feels different from typical soreness or fatigue. In addition to bone-related discomfort, foot pain can also arise from a buildup of uric acid, a waste product that is normally filtered out by healthy kidneys. When kidney function declines, uric acid can accumulate in the bloodstream and eventually crystallize in the joints. This leads to a condition called gout, which frequently targets the big toe. Gout attacks can be sudden and extremely painful, with swelling, redness, and heat around the affected joint. Some people describe the sensation as feeling like the toe is on fire or being crushed. Even a light touch from a bedsheet can cause sharp, unbearable pain. These flare-ups are more than just painful, they're strong indicators that your kidneys may not be filtering properly. Unlike the kind of soreness that follows a long walk or poor footwear, foot pain linked to kidney issues is more persistent and harder to explain. It often comes with other subtle signs of kidney trouble, like swelling, fatigue, or changes in urination. If you're experiencing chronic or unusual foot pain, it's important not to ignore it. Talk to your doctor and request a full evaluation of your kidney function. Addressing the root cause early can help prevent further damage, reduce discomfort, and potentially avoid the need for more serious treatments down the road. Your feet may be trying to tell you something important. Listen to them. 4. Changes in skin color. Changes in the color of your feet may seem like a cosmetic issue, but they can actually signal something much more serious: kidney disease. One of the lesser known but crucial signs of declining kidney function is poor circulation, which can cause noticeable discoloration in the lower extremities. When your kidneys are not working properly, they struggle to manage fluid levels, blood pressure, and mineral balance. Over time, this can affect your blood vessels and how efficiently blood flows to various parts of your body, especially your feet. As a result, your feet may begin to change color, appearing pale, bluish-reddish, or in severe cases, even black. Pale feet can indicate reduced arterial blood flow and a lack of oxygen being delivered to the tissues. If the feet begin to look bluish, this may be a sign that oxygen levels are especially low, a condition that can worsen if blood flow continues to deteriorate. In the most serious cases, gangrene can develop, turning parts of the feet black due to complete tissue death caused by a lack of circulation. Discoloration doesn't only result from poor blood flow. Kidney disease can also lead to high phosphorus levels in the blood, especially when the kidneys are unable to properly filter and remove excess minerals. Elevated phosphorus can cause chronic itching and inflammation, leading to dark patches on the skin, especially around the ankles and feet. Scratching due to itchiness may worsen these changes, sometimes resulting in sores or open wounds that are slow to heal. This not only increases the risk of infection, but also further darkens the skin in those areas. Additionally, diabetes is the leading cause of kidney failure, and it often brings its own set of complications that affect the feet. People with diabetic kidney disease may develop poor wound healing ulcers and changes in skin texture or tone due to nerve and vessel damage. These combined effects often leave the feet looking red, blotchy, or darker than normal. If you notice sudden or progressive changes in the color of your feet, especially if accompanied by other symptoms like swelling, numbness, or poor healing, it's essential to speak with a healthcare professional. These visual changes may be your body's way of signaling that your kidneys are in trouble. Early detection and treatment can make a significant difference in managing kidney disease and preventing further complications. Don't ignore what your feet are trying to tell you. 5. Dry, itchy feet and ankles. Dry, itchy feet and ankles might seem like a simple skin issue, but they can actually be a hidden sign of something much more serious: kidney dysfunction. When your kidneys are working properly, they filter waste toxins and excess minerals like phosphorus from your blood. But when kidney function declines, these toxins begin to accumulate in your body. One of the most common and uncomfortable results of this buildup is pruritus, an intense chronic itch that often affects the feet, ankles, and lower legs. Elevated phosphorus levels are a major culprit. When phosphorus is not properly excreted, it can trigger irritation in the skin, leading to relentless itching that no amount of lotion seems to relieve. Patients with advanced kidney disease often describe this sensation as unbearable, sometimes even worse than physical pain. They scratch until their skin breaks, creating open wounds that can become infected, especially if healing is compromised by poor circulation or diabetes. Dryness often accompanies this itching, creating a perfect storm of discomfort. Kidney disease can lead to dehydration and disturb the balance of electrolytes in the body, further drying out the skin. Additionally, people with kidney failure often experience vitamin deficiencies, particularly in vitamins A, D, and certain B vitamins, which are essential for healthy skin. Without them, the skin becomes more vulnerable, thin, flaky, and prone to cracking. Some patients also experience changes in sweat production and oil gland function, which contribute to the dryness and make the skin feel rough or scaly, especially around the heels and ankles. This kind of itching is more than just irritating, it's exhausting. It often intensifies at night, interfering with sleep and affecting mood focus and overall quality of life. Many people try topical treatments without success, unaware that the source of their problem lies deeper in their kidneys. While it's important to rule out allergies, eczema or contact dermatitis, persistent itching in the feet and ankles with no clear external cause should raise concern. If you find yourself constantly scratching your feet or waking up with dry, irritated skin around your ankles, it's time to look beyond the surface. Talk to your doctor and request a full kidney function panel. Addressing the root cause early may not only relieve your symptoms, but also help protect your kidney health in the long run. Your skin is often a mirror of what's happening inside your body. Don't ignore what it's trying to tell you. 6. Foot ulcers and poor healing. Foot ulcers and poor healing are among the most serious and alarming signs of underlying kidney disease. When your kidneys begin to fail, the consequences go far beyond changes in urination or blood pressure. They can quietly affect nearly every system in your body, including your circulation and nervous system. Poor circulation, particularly in the lower extremities, means that oxygen and essential nutrients are not reaching your tissues effectively. This can cause even minor cuts, blisters, or pressure points to become chronic wounds that refuse to heal. These slow-healing ulcers often start off small, perhaps as a red spot or sore near the toes, heels, or ankles, but they can quickly worsen without proper care, especially if you're not checking your feet regularly. At the same time, kidney disease often brings about peripheral neuropathy, nerve damage caused by the buildup of toxins the kidneys can no longer properly filter. When nerves in the feet are damaged, you may lose sensation and not even realize you've injured yourself. A small pebble in a shoe, an unnoticed blister, or a tight seam in a sock could create enough friction to break the skin. Without feeling the pain that would normally alert you to the problem, you might continue walking on the injury, worsening it day by day. Eventually, this combination of reduced sensation and poor blood flow creates the perfect storm for serious infections. Infections in the feet can quickly become dangerous, particularly for those with kidney disease and diabetes, two conditions that often go hand in hand. Because the immune system is also compromised in advanced kidney failure, your body's ability to fight infection is significantly weakened. Wounds that would normally close within days can linger for weeks or months, turning into deep ulcers that reach muscle or bone. In the most severe cases, these infections can spread or lead to tissue death, making amputation the only remaining option. If you're experiencing wounds on your feet that don't heal, discoloration around ulcers, swelling, or signs of infection like warmth and discharge, don't wait. Seek medical attention immediately and ask your doctor to evaluate your kidney function. What seems like a simple sore could be your body's urgent warning sign that your kidneys are struggling. Early diagnosis and proper management of kidney disease can help restore circulation, prevent nerve damage, and reduce the risk of life-changing complications like amputation. Your feet are talking. Make sure you're listening. 7. Restless leg syndrome. Restless leg syndrome, or RLS, is a neurological condition that causes an uncontrollable urge to move the legs, often due to a creeping, crawling, tingling, or uncomfortable sensation. While it can affect people of all ages, it's especially common in those with chronic kidney disease. What makes RLS particularly challenging is that it typically worsens during periods of rest or inactivity, especially in the evening or at night when you're trying to relax or fall asleep. Many people describe the feeling as something moving under the skin or a buzzing electricity that only gets better when they shake, stretch, or walk. Unfortunately, this constant need to move can make it difficult to get restful sleep, leading to fatigue, irritability, and poor overall quality of life. One of the reasons restless leg syndrome is commonly seen in people with kidney problems is because of its close connection to anemia and low levels of erythropoietin, a hormone that is produced by healthy kidneys. Erythropoietin plays a critical role in making red blood cells, and when kidney function declines, the body produces less of it. This can lead to anemia, a deficiency in healthy red blood cells, which is strongly associated with the development or worsening of RLS symptoms. Without enough oxygen-rich blood reaching the legs and feet, the nerves may begin to misfire, creating those strange and uncomfortable sensations that drive the need to move. Although the exact cause of RLS is still not fully understood, it's widely believed that disruptions in the brain's dopamine pathways may also play a role. This further links RLS to chronic health conditions like kidney failure, where metabolic imbalances can affect the nervous system. People with kidney disease may also experience iron deficiency or imbalances in minerals like magnesium and calcium, which can further irritate nerves and worsen RLS symptoms. Left untreated restless leg syndrome can become a chronic issue that interferes not just with sleep, but also with daily comfort and mental health. If you find yourself constantly needing to move your feet or legs, especially when you're lying down or sitting for long periods, don't dismiss it as a simple habit or restlessness. It could be a sign of something deeper going on with your kidneys. Talk to your doctor and request a full evaluation, including kidney function and iron levels. Catching the connection early can help manage symptoms and protect your long-term health. Your feet are more than just the foundation of your body, they're powerful messengers. From swelling and discoloration to tingling and ulcers, these signs are often your body's first cry for help when your kidneys begin to struggle. The problem is, most people ignore them or chalk them up to aging or fatigue. But by paying attention and acting early, you may be able to slow down or even prevent the progression of kidney disease. If you've experienced any of these symptoms, don't wait. Talk to your doctor. Ask for a full kidney function panel. Remember, kidney disease often creeps in silently, but your feet might be trying to tell you the truth before the labs do. If this video helped you better understand the warning signs to look out for, please give it a thumbs up and share it with someone who needs to hear this. And if you're passionate about aging wisely, staying sharp, strong, and vibrant at every stage of life, then you're in the right place. Hit that subscribe button and turn on the notification bell so you never miss a video from Ageless Mind and Body. Your trusted guide to living longer, living stronger, and living well. See you in the next video.